What's up, everybody? My name's Ange, and I am a left leg amputee. Welcome to my channel. I had surgery recently. I went through my 6th amputation to my left leg, and this is just an update on that. I've just been videoing kind of in a way vlogging, so it's like bits and pieces of my experience so far. I had my surgery on January 3rd, which was exactly 2 weeks ago yesterday. And yeah, so thanks for being here, and we'll just dive right into it. So I'm just waiting. We're about to leave and go over to the hospital. So I don't know how good you can hear me because I don't have like a microphone. And anyways, yeah, but I'm just waiting here. Like, just waiting. I think because one of the worst parts is just waiting, because that's when you get nervous and it sets in that you're about to have surgery or something big done to your body, and they're gonna put you to sleep and they'll take good care of you. And I trust my doctors wholly, and my cute nurses, they're amazing. And I don't know, it feels a little weird, just being chilling back here. So they got my IV in and one stick, so that was good. That doesn't always happen. In fact, there's times that they've had to use an ultrasound in order to find the vein, in order to get it to go in, which is kind of ridiculous. But I think that depends on, the day and on how hydrated you are and that kind of stuff. So, and I'm definitely dehydrated because it's like 2 o'clock in the afternoon right now, and of course they don't let you eat or drink anything, and so yeah, it's not too fun, but that's okay. We'll get through it. I got this.
2 hours later.
It's official. I'm starving. Like, I'm really hungry. I made the mistake of not eating last night, obviously, before you have to start fasting, and I fell asleep actually, which is kind of good because I deal with insomnia. So I fell asleep, and then I didn't get to eat when I should have, and so yeah, I'm kind of paying for that right now. I'm kind of annoyed with myself, so I don't know what I'm talking about. I'm just blabbering because I'm waiting for surgery and I'm nervous. So, I don't know why, but these are the worst hat things that they have you wear. So the surgery went well, as far as I was told. I'm still completely out of it. I have anesthesia still going on, and yeah, I'm in a lot of pain. They did a lot with the muscles in there, and so I keep having like muscle spasms and Charlie horses, and so I'm really trying to figure out how to keep on top of that. They gave me a muscle relaxer, and hopefully that will nip that in the bud. It's really, really uncomfortable right now, but I'm at least at home, and once I can get on top of the pain and the Charlie horses or the cramping that's going on, then I think I'll do okay. I can kind of relax a little bit. Yeah, surgery number 45 down. 6 amputation in the books, and we are well on our way to walking again. And I appreciate you guys for being here along on the journey. And if I'm not making a whole lot of sense, well, anesthesia is why. Because I literally just got home and I'm trying to figure out what's up and down and left and right. And anyway, I love you guys. I appreciate it. Everything you do, and all the prayers and
good vibes and all of the things, and it means everything to me. And you have no idea how much it helps propel or make me want to succeed, because I truly do want to succeed, and it's been a really long journey. So yeah, I'm gonna take off for a bit. So all right.
So, what did they do in the surgery? That's where we get to this now. Um, it was a little more complex than what we had anticipated. Originally, my doctor said that he was going in to take off the nerve tumor, which is called the neuroma, and then he was going to take some of the slack out of my quad muscles because there was too much, they were too loose, and it was complicating things and creating a lot of pain. Well, they got in there and things were not what they seemed. So, a half an hour surgery turned into a 3 hour surgery. First, they put me under, right? I went under anesthesia, and as you could see in the video just a moment ago, I actually was pretty out of it when I took that video. That was right when I got home. So the surgery itself, I keep getting off topic. Okay, so I had this neuroma, which is another word for a nerve tumor. It's basically the nerve itself is super damaged and starts to try to repair itself. And it continues to try to fix itself so much that it just grows and it grows and it grows. And it's just a giant mass nerve growth. And so that we knew was in there, and they went in and they were going to take that out. Well, when they found it, it was on my sciatic nerve, so that was the first interesting complication, something we didn't foresee. They took my sciatic nerve and they pulled it, he said, 4 inches, quote unquote, outside of my leg, and clipped that nerve tumor off, as well as those 4 inches of my sciatic nerve. And then they let it retract. It kind of like an elastic, like that. It retracts back into the muscles. And the hope is that the nerves basically will find a home within those muscles to reintegrate. And that way it doesn't continue to try to heal itself and become another nerve mass or another nerve tumor. That was, let me think, I think my third or fourth neuroma that I've had taken off. And yeah, they're no fun. They made it really hard for me to try to use my prosthetic, which, if you don't know and you're just new to here and this is your first video, I'm in the process of trying to learn how to walk again. And that's when I ran across some issues, and so that's why you are getting a surgery update instead of a prosthetic walking update. So they took care of that. My femur bone had a growth on it, and they wanted to know, what that was, and so that ended up being something called a bursa, and there was fluid in it. So it was basically bursitis on the tip of my femur bone, which causes a lot of pain. And so they had to take and basically, the best way that I can describe it is sand it down and make it all smooth. So they took that off and made it all smooth so that they could work with the muscles, because that was the next issue, was that they thought I had slack in my quad muscles. So they smoothed that down, got it all ready so they could fix my quads, and then they realized that my quads didn't just have slack in them. This is where it got a little more complicated. So the quad muscles that had been kind of snapping back and forth across my femur bone, they were completely detached from my femur, and my quadriceps tendon, it was torn away. So that was a big surprise. My quads were not attached to my femur bone at all, and neither was my quadriceps tendon, and I don't even know how I did it. they said it's obviously been like that for months. I'm not even sure when it happened, to be honest. Um, and yeah, there was a lot of pain with it. And that's, I never know what is normal pain or what is not normal pain, because navigating an amputation, and especially an amputation with that's like mine, it's fairly complex. And I've had some, you know, they're atypical issues. They're not typical, and so it's been kind of frustrating actually to go through it, because we have to keep going through it until we get it right. So my doctors were amazing. They went in and found exactly where they had gotten torn away from my femur in there, and they figured out where the quadriceps tendon was torn away from, and then they began to repair it. And it took a couple of hours instead of just a little 45 minutes to an hour long surgery. It ended up being a few hours of very it was difficult surgery, actually. They attached my quads with something called like a flexi band. That is just something that, for obvious reasons, it's flexible, and that way, because when your muscles flex, they contract and then they relax. You have to have something that's flexible in order to work with those muscles. So they were able to connect the quad muscles and connect them to the hamstring, and they connected the quads to each other, and then they connected that all to the quadriceps tendon. And I'm probably butchering this. I'm not a medical professional, so any orthopedic surgeons out there or whatever, that feel free to drop in the comments what actually the technical terms of this are, but because I don't know. I just know that they attached everything to itself, and then took it and it anchored it to my femur bone. So it was a complex surgery to get my muscles back onto my bone. So they took the tumor out and fixed the nerve, my sciatic nerve, back into the muscles, hoping that we don't get any more of those neuromas. Crossing our fingers. Then they fixed those muscles, and then the next thing that they did was they took off several inches of excess tissue. It's called adipose tissue. It's basically just skin. When you lose as much muscle as I have in my leg, the atrophy and whatnot, you get skin that's just very loose. So it's kind of like a tummy tuck, only it's for your leg. So I basically had a leg tuck done. So it's kind of crazy if you think about it like that. So the leg tuck, quote unquote, it was successful, and they were able to close me back up. The incision is massive. It's about 15 inches long. It starts from one side of my leg, goes all the way around the end of my femur bone, and then up to the top of the top of my inner thigh. And it's sort of like, picture sort of like a fish mouth opening and closing. That's sort of like the way that they do the incision, if that makes sense. And so I have 30 some odd staples, and they've been in there for about 2 weeks now. They're super uncomfortable, but it was necessary to keep them in. I went to my post-op appointment, and due to the swelling, they didn't want to take them out yet, because that puts me at risk for having that incision pop open, and that is not something we want to do. So everything looks good other than that. And yeah, this has been kind of a crazy ride. Like, you just never know what's going on in there until they actually get inside and take a look. And so I feel like it was successful. I'm glad that I was able to do it. I'm glad that my muscles are back attached to my femur bone. I will say that they're angry. I keep saying my stump is angry. It's like having a tantrum. It's definitely not happy. I'm still in a lot of pain. They had me on different medications, and they are working fairly well. What's interesting is that my body responds well to some medications, and then it doesn't respond to other medications. And I've had a very difficult time sleeping because of the pain, and so they ended up a couple of days ago giving me something to help me sleep. I've not seen a huge difference yet in my sleeping, but I'm hoping to get some more sleep soon. After I get done recording here, I'm actually going to go and lay down. It's interesting because one of the there's probably been, how many surgeries? Okay, this will be the 45th surgery. The first surgeries, I never had a problem with sleeping, but the last probably 10 surgeries that I've had, it's just gotten harder for me to sleep due to the pain and muscle spasms. That's one thing that's been absolutely horrid this time, is the muscle spasms. That's definitely because of all the work that they did. Now my muscles are where they should be, and they don't really know what to do because they were just, I don't know, they were having a party. They were just free and floating around in there and doing their own thing for, the last who knows how many months. We are all very perplexed as to why they tore off, and I'm not too happy about it because that makes me nervous. If I don't know how I did it, I don't really know how I can prevent it. So I'm just, gonna try and be aware of everything. To be honest, it's been pretty miserable, and you can probably tell I'm really tired. I'm still there, still trucking and still going, but I'll be glad when this is over and when I'm on the other side of this and the staples are out, and I've got a couple more weeks between the surgery and hopefully the pain will lessen and the spasms will lessen and whatnot. So we had a slight scare where they thought I had a possible blood clot, so I ended up in the emergency room. I had a little tiny video that I can post of that. It was actually kind of funny. My mom had root beer barrels, and I don't know, it's just the little things that make you laugh. And I was miserable, and I had been crying and very frustrated, and I was hurting so bad. And she handed me a root beer barrel, and it just made me laugh. So I popped this root beer barrel in my mouth and start laughing and joking, and I don't know, it meant a lot. My mom's amazing. She's really fantastic, and laughter is what gets me through everything. It truly is. And sometimes it's even dark humor because, that's what you get out of this, is trauma and dark humor. There's not a lot of other things. I guess there's a few things that you can get out of it, patience and different virtuous things that you can get from going through these things, but my head's just not in the right space to sit and tell you what I've figured out at this moment. So so I hope that makes sense. And if not, drop it in the comments. If you have any questions, please feel free to ask. I am more than happy to share, and I actually really like when you guys ask me questions because I like to engage with people, but more than that, I feel like having you guys along for this journey, it helps propel me to do better. It helps me to push myself to not give up and to keep striving to walk again, and we'll get there. Sometimes there's just bumps in the road, and this was a pretty big bump or a pothole. I don't know what you want to call it, but we got around it. We got over it. So we're going. So, anyways, it's windy outside. That's why I keep looking around. But, I will talk to you guys soon, and you guys have a great day. Sometimes hospitals and doctors' offices, physical therapy offices, and they become like a second home. I suggest you bring Dad's root beer barrel when you have issues,
because they make life fun.